Hey there, everyone. It has been a long time since I've videoed, okay? And I severely apologize. I'm going to try to put this video and the last video, which was from a month and a half ago, up about the intro and um, everything that happened in your initial visit to the bariatric center and everything, or as they call it, the Bariatric and Metabolic Institute with Dr. Samuel Bledsoe. So I kind of want to go ahead and get into this video without, making a whole long whatever, okay? This video we're going to be talking about insurance with doing bariatric surgery. I'm going to say this, preface right off the bat, that everybody's insurance is going to be different. The requirements are going to be different. We'll get into that in a little bit of detail. But you also need to understand that it's important for you to ask a lot of questions, not only to the Bariatric Institute, but to whoever you have insurance with. Like, one of the first things that you need to say is, I'm considering having bariatric surgery. What is the details on whether or not you would cover it? If you did cover it, how much of it would you cover? And, the importance about the finances. And then ask them, if they do cover it, how long the duration of your contract is before you're allowed to have the surgery. Okay, so those are some questions that you would need to ask right off the bat. So one of the big things about insurance is a checkoff list. Okay, it means that you have to go through certain clearances, which I will do a separate video for. Okay, I'm not going to go into detail about it. I'm just going to show you the list. I have dates marked on there. I'm not going to try to zoom into it or whatever and let you see. It's just showing you a visual aid of what they give you at the bariatric hospital so that you know what your next steps need to be. Okay? So this here is a preparation list, okay, that will show you each step that you need to go through. I mean, the very first thing it says, like I said in my first video, was about the seminar, and then your first office visit. Okay, everything else about that has to do with your clearances, your finance, getting cleared by all your doctors, and then making sure that your insurance accepts everything that gets sent to them in order for you to be told whether or not your surgery will be paid for. If not all of it, but part of it, and what the percentage of that part is. Okay, so that you'll know how much out-of-pocket cost, or if you're going to have any at all. Okay. The second thing is that when you go into the office, okay, one of the very first things that they give you, and this is without them knowing your insurance status. So it really doesn't matter what type of insurance that you have. This is a requirement of their office to let you know that everything that you do within the office is costing you money, and it's a breakdown so that you understand what you're paying for. Because a lot of times when you go to a doctor's office and they don't tell you anything. You go in there to see the doctor, especially if you go into the ER or something, okay? And you go to the doctor, and then later on when you receive your bill, it's outrageously expensive, but nothing was ever explained to you of why it costs so much. Okay, so then when you look at the bill and you start looking at the breakdown, and you start thinking to yourself, all these things are so ridiculous, and I wish that someone would have told me. Well, this clinic actually gives you a provider-based clinic billing form. Okay, and basically what it does is that it tells you what provider-based means. It gives you a definition. This says that this is a Medicare status for hospitals and clinics that comply with specific Medicare regulations. The Arkansas Heart Hospital Clinic has met these regulations and is designated as such with Medicare. This status requires that the services you receive at the Arkansas Heart Hospital Clinic will be billed in two parts. Two parts. Okay? So, it then tells you that you will end up receiving two statements. Okay? And then it explains to you why you're receiving two statements. Well, the two statements is because there is a hospital facility fee, which means that anytime that you're using the hospital in order to do clearances or procedures or the surgery itself, all of that is part of the hospital fee. Okay? Then you have your healthcare provider fee, which is everything having to do within the physician's office. So in Samuel Bledsoe's office, everything that you do within that office, that is those fees. So it's two separate bills, okay, that will be billed to your insurance company, okay? And sometimes some insurances will cover it. Other times, some insurances won't. You know, I've heard a lot, not specifically of my own accord, but I know some people that have went in with like Blue Cross Blue Shield and their insurance wouldn't cover anything of it. When they spoke that they were considering getting bariatric surgery, the very first thing is they said, no, we don't cover things like that. So I think it's just really important that before you even like get into the qualms of talking to Dr. Bledsoe or even scheduling for your seminar, I would talk to my insurance company first. Above everything else, talk to your insurance company. I think that is so important, okay? It then gives you a breakdown of the charges and how they would be charged, okay, depending on what kind of insurance that you have. Seeing as how that I'm disabled and I get Medicare and a different type of Medicaid, my primary insurance is Medicare, so most everything gets claimed onto Medicare for me. So basically, you look down here at the very bottom, down here, this breakdown, and it will tell you, depending on what type of Medicare you have, be it Part A or Part B, and will tell you how you're being charged per what service. Okay? So then that way there's not anything, you're not in the dark about anything. You're being explained everything up front without question, and you know, there's no misunderstood things that are happening that you don't know about. Basically, in the end, you sign. Okay, so within this, it also gives them a right. Because you sign for this specific paperwork, so you sign for it. But it's giving them the consent to obtain external prescription information, everything that you've ever had in your history. It gives them like patient safety acknowledgement, so that you know that you're in a safe facility, that everything that is discussed within the facility is between you and the person that you're discussing, and nothing will be discussed with others unless it has to do with that specific care for which you are going to that physician for. Do you understand what I'm saying? So if it's other doctors or that doctor's assistant or whatever, that information will be shared with them because it has something to do with either your clearance or the surgery that you're going to have. It also, you're also signing this for authorization for payment and treatment. So it allows you to be treated. Um, and then, like, you're also creating a joint agreement between you and the Arkansas Heart Hospital, saying that you agree to these terms and conditions. Um, and then it explains to you all the external agencies that are available to you, in case if you need to contact someone about anything having to go on with any of your procedures or doctors or billing information whatsoever. So you pretty much have everything that you need there, in order to, I guess, get the billing process started. Okay, so as I was saying, then after they do that, especially when you come in to your first visit, one of the main things that they make you sign is the insurance agreement, that you will comply to all clearances, and that depending on what type of insurance that you have, you will be in a insurance requirement phase anywhere between 3 to 6 months. Mine was only 3 months, because you can see right here I had 1, 2, 3 months, but these spots are remaining for 6 months depending on the type of insurance that you had. And of course you have to sign it. It also will say to you here, like, you can see it right here, 0, where it says that I was 0 responsible for anything for my surgery, that my insurance paid for everything. So again, that's one of them things that you would need to discuss with your insurance company as well as the clinic, and they would then be able to intervene and speak with your insurance and see if you qualify and what you qualify for. Then after that, that's when you have to sign this contract saying that you agree to the terms and conditions. My 3 months have already passed by, and now I am in the waiting period for the actual surgery. I actually have a date that will be discussed later in a different video, but have all this done. Just saying that I agree to do all my clearances and my 3 months for the insurance. Okay, the very last thing, or there's 2 more things, but the next thing is that you sign a different kind of contract. It's this thing. And just to kind of give you a breakdown for it, it's telling you that you agree to the surgical education and program participation. That means that everything that is included within the program and surgical preparation, excuse me, can't speak, that you agree to participate in 100% without question. That everything that they tell you to do, you must do. Okay? The second thing is that be that you're a smoker or you live with smokers or whatever, that you must abstain from any nicotine use or be around nicotine use after your surgery. You're also not allowed to use alcohol after the surgery at all, so that's something else that you agree to. If you are a woman, you agree to abstain from pregnancy after surgery, and that if you happen to get pregnant, that it may affect your surgery results, as well as you may have to have it redone depending on the situation. And then it gives you a breakdown. You agree that everything that they've discussed with you, there is a list here. You can actually see this teeny tiny list right here with all these bullet points. Says that they have discussed all of these things with you. It actually continues on to this next page here. see, on and on, and then you sign and date it saying that you agree with everything that they have done for you in the office up to this point. Okay. The very last thing is that once all of your clearances are done and you discuss it with the insurance company and you finally get through your last appointment, which would be your psychological evaluation. Okay, so once you get completed with that one, then they will take you to another office or to another room by yourself, and the scheduler and lady that goes over your insurance requirements with you and all that comes into the room, and this is your last thing stating that your insurance has completely agreed to you having the surgery, okay, 100%, and then has you sign a document stating the total amount of the surgery and that total amount of the surgery, what insurance is paying for, and then what you will be required to pay. Okay, so we're not going to get up close to this page. I'm actually going to pull back this way. I don't really want people to see this number. I will kind of give you a guesstimation, but basically it gives you a rundown in numbers telling you what the total amount of the surgery is, what you owe, all those things, any requirements from your insurance, otherwise for payment, and then you would sign and date it down here at the bottom as well. Okay. Basically, it thanks you for choosing the Arkansas Heart Hospital for your healthcare needs, and that that now all you're waiting for is your last appointment 1 week before your surgery day. So once that is done, then you know your date, your time, the location, your last instructions that you must know, and then again it's another week-long waiting period before you go to surgery. During this last month, I'm going to try to finish my videos about each one of the clearances and what was required and all those things, and try to get up to date with all of these videos so that when it comes up time for me to go to that last appointment, I can video about it. And then pre-op for surgery, I'll have someone video the day of what my weight is going in, all of that stuff, so that people know what's going on, and then that way I can document that for you too. Some people get a little frightened and they want to know what's going on. So I hope that was very informative to you. Sorry I'm speaking so fast. I don't have that much time on my phone. It could die at any minute right now. But I hope that was informative. I hope that this was helpful to you in any way. If you have any questions for me, please don't hesitate to send me a request or leave a comment down below or anything. Okay, I am here. I am struggling through this just like other people that go through bariatric surgery. So it's been a long, hard road. It has been a lot of red tape to go through, but I know that in the end it will be worth it. I look forward to hearing from you guys. If I don't, that's okay too. Basically, this is also my way of getting out what's happening to me through, not only being... Sorry about that, guys. My phone had died. But like I was saying, if y'all have any comments, questions, or anything that y'all want to know or need some help with, or just don't say anything at all, it's, hey, you know what? For me, this is just an outlet, and it gives me a chance to voice my feelings about things, and also, the things that have happened over the last few months. So, that's pretty much all I got to say. Hope that this was informative and helpful, and I guess I will catch y'all on the flip side. Peace. Bye, y'all.